Hi, this is Dr. Sherry Shabowski from Medical Education in Minutes, and today we're going to learn something about the diagnosis of intravascular hemolysis. This is a quick one. Okay, let's start with the causes of intravascular hemolysis. Immune-mediated destruction can be subtyped into transfusion reactions, autoimmune diseases, disseminated intravascular coagulation or DIC, thrombotic thrombocytopenic purpura or TTP. Mechanical trauma can cause intravascular hemolysis, which is kind of crazy. So, prosthetic valves can actually cause some low level of intravascular hemolysis. Infections like malaria can cause intravascular hemolysis. And hemoglobinopathies like sickle cell disease can cause some degree of intravascular hemolysis. The signs and symptoms of intravascular hemolysis include anemia. No big surprise here, red cells are being destroyed. Because red cells are being destroyed, reticulocytes or immature forms are being released into the circulation. Schistocytes are damaged red blood cells that have kind of an unusual form at that point. They are seen on the peripheral smear. You have increased LDH or lactic dehydrogenase. That's because lactic dehydrogenase is very concentrated within the red cells, and when they explode, it's released into the blood. You have a decreased haptoglobin because it is used up when you have intravascular hemolysis. And you can wind up with dark urine, which can be caused by hemoglobinuria or hemosideruria. A Coombs test being positive is quite specific for immune mediated hemolysis because the test checks for agglutination with respect to antibodies. Now let's go through it here, just so we have it covered. With intravascular hemolysis, the red cells are destroyed within the blood vessels, thus the name. This causes anemia. Again, not shocking, you're destroying red blood cells, and triggers the reticulocytes or immature forms to be released from the bone marrow in order to replace them. The red blood cells are full of lactate dehydrogenase. So when there's intravascular hemolysis, LDH is released into the blood, causing those levels to be high. Now, this guy is the actual problem. Free heme. Free heme is released into the blood, and free heme is dangerous. So it is bound by circulating haptoglobin that comes from the liver. When it's bound, it cannot be filtered into the kidneys because when it gets in the kidneys, it literally wreaks havoc. But if there is more free heme than circulating hemoglobin, free heme can be filtered into the kidneys. In the proximal tubules, it makes oxygen-free radicals that result in severe damage to this area. It can cause acute tubular necrosis and potentially renal failure. Also, the particulate matter can become clumped up in the proximal tubule, resulting in cast formation. These are hemoglobin casts. Extravascular hemolysis does not lead to intravascular hemolysis, but intravascular hemolysis typically is associated with some degree of extravascular hemolysis. Damaged red cells may be detected in the peripheral smear as schistocytes. So these don't completely undergo hemolysis, they're just damaged. You will see these in intravascular hemolytic anemia, DIC, TTP, and with mechanical valves. They will circulate and be destroyed in the spleen. extravascularly. Since immune-mediated hemolysis is caused by the complement cascade, you will have the membrane attack complexes that cause that intravascular hemolysis, but also you will see opsonization of red cells that are picked up by the macrophages in the spleen and degraded, resulting in extravascular hemolysis. In the spleen, red blood cells are broken down into heme, iron, and globin. Iron is recycled, globin is broken down into its amino acids and recycled, and heme is broken down into bilirubin, which binds to albumin and circulates in the bloodstream, causing jaundice. I hope this helps you to understand and remember the clinical and laboratory findings that diagnose intravascular hemolytic anemia or hemolysis. There's more hematology content on my YouTube channel, and if you like this style of teaching, there is full course content at www.medicaleducationinminutes.com. Okay, great. See you next time.